hands raised. So, I have a questions for all speakers. As it has been explained, organizations such as WHO, UNICEF recommended maintaining good quality standards in perinatal care in the very beginning of the pandemic, but which barriers do you think we had in all countries to follow those recommendations?
For us, it was important to have the previous experience because we had the previous experience from Asia and from Europe, and we collected all the available evidence. Our beginning was later, on March. So I think that one of the main reasons that our experience was better is the advantage to learn of this case series. Also, the joint work of associations like Kangaroo Foundation, neonatologists and pediatricians associations, fathers also included, and the fact of having a national protocol adapted for each neonatal care unit. I think that it was the success in our country, because we are a middle-income country, and I think that with little resources we could break the barriers based on available evidence with epidemiologists' public health work.
At the initial of the pandemic in Spain, this was very soon, so we have the barrier, but we don't have enough information in the literature to bring to the hospital, to the director of the hospital, and to have the recommendation for all the patients, the newborn were included. And the parents of the newborn were as well as the parent of the NICU adult. So I think it's a good idea to consider the parent as the health professional for her baby. And that is not easy for us to understand, but it's not as easy for the director of the hospital.
Hola, buenos días. Muchas gracias a todos por las exposiciones. Mi pregunta era para Pierre Kuhn, de Francia. Ha hablado de la importancia, por supuesto, del alojamiento conjunto con los padres, pero quería saber si se contempla también el acceso ilimitado a otros familiares, a otros acompañantes de elección de los padres. Incluso también podría ser de voluntarios en caso de que no existiera la posibilidad de que hubiera padres, para garantizar el contacto piel con piel con otro ser humano, cualquiera. No cualquiera, sino alguien que estuviera dispuesto a mantenerlo. Y también otras realidades de unidades familiares que no sean compuestos de padre y madre. Muchas gracias.
She asked about not only parental involvement in the unit, but also other relatives or maybe visitors, not only parents, the paper they have in the unit.
Oh, okay. No, I mean, the main aim was to support mothers and fathers' presence in with the baby, and as there was a lockdown regulation, all the members of the families were not allowed to come because they were not allowed to leave their home during the first wave of the pandemic in France and in many countries. So we thought that we really need to focus on the parents, the mother and the father, who really need to be with the baby. So, and this was the question about the siblings. And in the first wave, they were not allowed to come, but after with immunization, they were allowed to come in the second, the third wave, if they were not symptomatic. But I think in many countries it was the case. I don't know whether I understand to your question or...
In India, when the epidemic started, pandemic rather, in the beginning our professional associations had a mixed announcement that you separate the babies, don't allow breastfeeding, don't allow skin-to-skin contact and all. So that very first protocol alarmed me. So we reviewed the extensive literature. I took a lot of help from Dr. Susan also. And then we brought out, and also we drew up our experiences from the HIV pandemic earlier. And considering all those things and weighing the benefits and the risks of keeping the babies together, allowing them the breast milk and all that, then we drew up our own guidelines and we sent an appeal also. And that appeal we had sent through different states also. And same thing, whenever you even suspect COVID also, or if the mother is positive tested, even then if mother and baby are not symptomatic, you keep them together. Even when the mother is mildly symptomatic, if she is willing to handle the baby, keep them together. Only when the mother is seriously ill and she is not able to handle, in that situation also, if express breast milk is possible, that we encourage. Only when the mother is critically ill and not there, only in that situation we did not allow. We have drawn out a simple guideline with all that thing. And of course, all the other infection prevention measures have to be followed. So that also we have given, and even what we call it as infection prevention measures, a full list. And even for the communities in the rural villages all, our health workers were also given these guidelines. They were carrying sanitizers with them, they were carrying masks with them, they were carrying the guidelines translated in the local language and explaining to the parents so that their fears are mitigated. In Indian context, involvement of fathers are not that much, but other family members are involved. Their fears also we tried to remove it here. Because many times even if the mother was willing, grandmother or others will say, you don't give breast milk, and they will whisk away the baby from her. So with all this situation, we had to do a lot of educational thing and written guidelines. And that has helped us a lot through the subsequent period. And subsequently, the professional organizations also modified their guidelines. And later on, even from American Academy of Pediatrics, WHO, all these guidelines came, which supported our recommendations. So this is the status in India.
Thank you very much.
While the next question comes, I would like to answer your first question, Barbara.
Thank you.
I think that in most countries, we have to be aware that WHO recommendations came very early. And for example, in Spain, the lockdown was declared on the same day that the WHO recommendations were published. However, most of the societies that misaligned with WHO recommendations were the pediatric societies. Well, of course, the CDC, but in the rest of the world were pediatric societies and neonatal societies. And and I think there's still a big importance of the influence of the industry relationships with these scientific societies. In our society and in our scientific societies, the real importance of breastfeeding and, for example, of kangaroo mother care are not truly adopted. We do not really those societies do not really believe on the importance of breastfeeding. So when I know that the tsunami situation was really difficult, and that was something that was true, and it was very important. But some of the abandonment and misalignment with WHO recommendations were because the risks were not truly measured. So the fear weighed much more because we didn't really believe on the damage that could be done, and that was already demonstrated, but we do not believe in that evidence. That's my think. These are my thoughts.
Hola, buenas tardes. Muy buenas tardes, desde República Dominicana les saludamos y abrazamos a todo ese auditorio cómplice de esta estrategia de amor. Nos interesa saber de cualquiera de ustedes, de los exponentes, las evidencias si tienen registradas sobre las posibles secuelas que pudieron o que tuvieron nuestros niños al ser interrumpidos en el seguimiento de las múltiples disciplinas, porque no pudimos hacer la detención temprana de las consultas de detención temprana de discapacidad visual, retinopatía, las discapacidades auditivas y todo lo demás que todos sabemos que debemos hacer en el seguimiento ambulatorio. Si tienen registros, si en esos largos meses de terror que tuvimos, si pudieron, si tienen y qué hicieron en estos casos.
I don't think we have the data in Spain, but here in Spain, the follow-up of the preterm infant in hospital was maintained. There was the baby, most of the baby comes to the hospital. There were more problems in the primary care with the term newborn. The normal newborn, maybe there was some problem, but with the rich preterm baby, they come to the hospital and follow up the screening program.
For Colombia, as I told you, intra-hospital KMC care is joined with the Kangaroo Mother Care Program. So Kangaroo Mother Care Program continued, didn't stop, and we have the screening for retinopathy and also neurodevelopment. So I think that it's an advantage, the join between Kangaroo Mother Care in hospital Kangaroo Mother Care and Kangaroo Mother Care programs. It's very important. We hope to have a larger follow-up. Now it is until 12 months corrected age, but we, with Kangaroo Mother Care programs, we guarantee the quality of life, because we can guarantee the survival with Kangaroo Mother Care, but the quality is guaranteed with the Kangaroo Mother Care programs, and it's an advantage of our country, I think.
I don't know the question because it was in Spanish. What was about the follow-up and the later consequences?
Follow-up of the babies in all the disciplines. If you have records of how it was.
Okay, so maybe I can say something, because we followed the babies that were born from mothers with COVID-19 infection. So it's only 26 diets, but the 10-month follow-up, we just published that last month, is very reassuring, but of course we still need to have more data, and there is some question about the possible effect on neurodevelopment because of viral infection during pregnancy, also the first trimester, second trimester. I mean, it is still an open question, but the data that are available are quite reassuring for the moment. I don't know if someone else has. Yeah.
We also have 6 months follow-up, and we don't find significant difference between the newborns who are COVID negative or who are positive, but we are seeing that out of 33 COVID positive neonates, 23 are coming to us till 6 months. whereas loss to follow-up is more with the COVID negative, maybe they have their own concern. So that was a surprising observation, but maybe these parents are more concerned and coming for more follow-up. But incomplete immunization, and India is seeing a lot of outbreak of vaccine-preventable diseases, which is, I think, probably everywhere in the world. And that is also one of the factors important for follow-up to ensure immunization, which was significantly and seriously impacted during this COVID times. Yeah.
I'm not sure. My name is Silke Mada. I'm from the European Foundation for the Care of Newborn Infants, where Pierre Kuhn has presented the data on the parent survey. What I want to add with this follow-up, what really was the problem from our parents in this time of the very beginning, from this first year, is that even follow-up didn't take place. So that means our parents were absolutely lost at discharge afterwards, and that means that all of this, what my son had, like physical therapy, occupational therapy, speech therapy, follow-up, didn't take place in the majority of the countries in the world. And that was one of the really big problems where our parents really were lost and were also worried that all the things what normally should take place, how can this somehow cope, because we all know how important is physical therapy for especially children who had a brain bleeding. And what our parents, and that's also something what I'm always wondering why parent organizations have to organize this, they organized then in the end this kind of Zoom meetings with a physical therapist, occupational therapist, but it was even not organized who pays in the end this therapy, because officially it was not a therapy like a therapy and all this kind of thing. So that's also what I just want to share, because there was this question about follow-up. And what really is important is to understand what happens with these children who not had at the end all this kind of support, and also the parents. And I also wanted to add, because the lady from the US asked why we have no data here from the US. I can tell you why you have no data from the US. Because our parent organization, we have a huge one in the US, and they had a lot of pressure from the nurses and also from the doctors' society that if they want to join this survey, they would risk the relationship between the societies and the parent organization. So they were so worried to join that they said, no, we cannot join, even with discussions with the Canadian organization and them and so on. And that is also from several organizations in the world. They were so worried to join, to not risk the relationship. And as the data then were published, as UPR said, the two publications, we also had a Lancet commentary. Then they realized what they missed as an opportunity. And what you also saw on the data, there's a huge lack in Africa, there's a huge lack in Asia, there's a huge lack in all these low and low middle income countries. And this is the reason, because we have that not parent-patient organizations, or the small ones, were in the end also putting pressure on them not to join. Because the language issue we could solve with the 27 languages, but not the pressure we had from the society. So just to explain why we have only the pieces of the countries, and you find also in our booth the whole survey, because of the 53 countries we have the data. So if people are interested on this. Thank you.
Thank you for those comments. I recognize the difficulty you were speaking of, and we do have one group in the United States. It's called Parents of Preemies, and Deb DeCenso is the head of that. She was a premature mother, and they publish very regularly. She does, especially in the journal called Neonatal Network, and she has voiced these same concerns that you have, and I know that Deb DeCenso is always at work, because every month you get an update on how they're trying to get the parents' voice heard and recognized and be respected by the healthcare professionals. Yes, thank you.
Disculpen de nuevo mi intervención. Hice esa pregunta porque en nuestro país cerramos totalmente en marzo. Fue todo muy brusco. Teníamos 23 niños, quiero compartir nuestra experiencia con el auditorio. teníamos 23 niños menores de 1.500 gramos, nacidos de diciembre a marzo 17. Después nos quedó la gran preocupación, sobre todo por el chequeo de la detección temprana de retinopatía. Pues nuestro encargado de la unidad de esa consulta de detención temprana de discapacidad visual por ROP abrió ya 3 o 4 semanas después, ante nuestra preocupación, y él vio a esos 23 niños, fuera de la estrategia que ya estaba establecida en el país ante el COVID. Miren, qué tremenda noticia. Había 3 niños ya en etapa casi con desprendimiento para discapacidad visual de la retina. Uno de ellos tuvo que entrarlo a cirugía, 2 inyectarle la medicación y quedarse con ellos para verlo semanal como debe ser. O sea, que el seguimiento hasta que estuvieran fuera de riesgo. Entonces, nos deja la experiencia de que si no, esos niños hoy hubieran sido niños con ceguera por este tema.
She said, I'm going to try to do it. She said they have 23 babies born between January and March 2020, less than 1.5 kilograms. And after the lockdown, they didn't have retinopathy controls. And when they reached to have those controls, they found out 3 babies had really severe retinopathy, and she asks how to act in these situations.
Yeah.
There were no controls.
Yeah, it's sad, of course. But of course, if you miss some opportunity to detect some lesion, especially retinopathy of prematurity, you missed an opportunity to treat it, and so it's. There are some side effects associated with COVID-19, and still now, because we are facing bronchiolitis, RSV infection and pandemics, and some other care in pediatric care have been altered by the pandemic with delayed consultation and with missed opportunity for diagnosis and treatment. So it's very difficult to have a broad view of all these side effects, but of course it is associated with the pandemic.
Unfortunately, we don't have time for more questions. It's lunchtime. I want to thank you, all of you, for being here, and all of you for your attention. And just to remind you that after lunch at 2:30, there will be a next table, KMC and Implementation Research. We wait you there. Thank you very much. Gracias a todos.